Welcome to the University of Michigan Dentistry Podcast Series, promoting oral health care worldwide.
What we have done now that we have determined that the angulation that we had selected was correct is we're proceeding with the fabrication of the drill guides themselves. What I have done off camera is to take our blocked out study cast and adapt the triad in exactly the same manner we did for the x-ray guide, and you will see that we have made depressions or outlines that are well clear of the orientation and the location for our two implant placements. So what I'm now doing is placing the 2.2 millimeter drill blank in our surveyor. I'm finding the exact location for my proposed implant placement. So I get the orientation so it's right where I want it, and then just carefully lift it straight up without twisting it at all. At this point, I just take, again, a little bit of the triad gel, place it in our depression. It will bond very nicely onto the triad that's already been cured. Now here again, what works very nicely is this Peter K. Thomas instrument does a very nice job of molding the triad gel so that it adapts very nicely to that drill blank. And so I'm going to, again, cure it 20 seconds from the buccal and 20 seconds from the lingual. Here again, I just loosen my surveyor, lift it straight up. I'll take my pliers, grasping the drill blank, twist it first, and then lift it up. Put my drill blank right back in my surveyor, orient my table. As we had talked about before, coming in very carefully and lowering my drill blank right down in the exact position, and then without rotating this at all, lift it straight up in the air. Come in with my triad gel, place my triad gel, lowering it straight down. The orientation of that is critical, and not rotating our vertical spindle of our surveyor rod is critical. Now what we're going to do is just make sure that surrounds and adapts to that drill blank very nicely. And we're going to cure this 20 seconds each side. Loosening the knob, lifting our surveyor vertical spindle straight up. Let's lift up our surgical guide. We just take our plier, grasp the drill blank, twist it first. Always remember to twist it first, and then vertically remove it. So what we're going to do first is lower down the occlusal till we're even. We're going to trim away any excess down at the tissue side. And then if we look straight down on this, what we've got now are holes that go down through here. I want to open these up to the buccal so that this drill blank can freely pass in and out from the buccal aspect. Trim the occlusal aspect, and that lets you see the top of those. Now when I turn it over to the tissue side, remember that I want to trim the lingual aspect to this a little bit so that when the surgeon lays their flap, I don't want the lingual aspect of my surgical guide to bump into their surgical flap and prevent this surgical guide from seating. I round off the buccal for any sharp edges. So the next thing I want to do is to come in and just trim away part of this excess material at the buccal. We're almost at the point where we're perforating through the buccal aspect. And when I sight down lengthwise, and I can see the area where the triad surrounds where the drill blank was, I want to clip out these constrictions so all I'm left with is the lingual 180 degrees of good adaptation so the drill blank can come in very freely. Carefully trimming that down to open those up to the buccal. So what I've now got are these two depressions, and I want to take my 2.2 millimeter drill blank and thread it up from the bottom, either from the bottom or down from the top. Now this threads up and down very nicely, so it fits in there and it's held very firmly. There's no wiggle at all, but it does not yet freely pull out to the buccal, so I need to do just a little more trimming on the mesial one. I check the distal one the same way, carefully. My 2.2 blank goes up and down very easily, but it does not come out to the buccal. You want to trial and error, trim this a little bit, but don't be too aggressive. But if I very carefully thread it through from the bottom to make sure it threads up, and then I'll say, does it come out freely to the buccal? And it does not. I'll just do this. Remember that on the forward one, it was just a little bit down at the cervical where it caught a little. And on the one that was more distally, it caught a little bit firmer. I have a little bit more relief to do on that. So we try this again, threading up from the bottom, making sure it comes out easily to the buccal, taking the distal one a little bit more yet. When I go to twist this mesiodistally, there's no tilt at all. So this gets very good guidance mesiodistally, and yet it's free to let the drill pass in and out from the buccal. So let me get this distal one just a little bit more. And it's the same again. We pass it up from below and see if it freely passes in and out from the buccal, and it does a good job of passing in and out freely. We go ahead and try it in, and we can see that there's no mesiodistal tilt once it's in place. So here's our 2.2 millimeter drill guide all set.
You've been listening to a presentation from the University of Michigan School of Dentistry, which is dedicated to supporting open learning and open educational resources. This recording is licensed under the Creative Commons. It may be reused and redistributed for nonprofit use. Please attribute materials to the University of Michigan School of Dentistry and redistribute under this same license. For more information on how this and other University of Michigan School of Dentistry recordings may be used, visit www.dent.umich.edu/license.